email channel, we're starting to get some questions about how do we keep our practices strong through this challenging economic time that we're all experiencing. And people are asking, do I increase my marketing? Do I reduce my teams to kind of keep things in line? What do we do? So you are, as an expert in this type of thing, what goes through your mind when you're talking to your teams about how to weather the storm, so to speak?
Well, I'm not surprised that you're getting a lot of questions with this regard. And surprisingly, or you won't be surprised, I get a lot of the same questions from my own clients.
Mm-hmm.
The way I like to look at it is that keeping up your new patient flow is going to be very, very important.
Absolutely.
And I feel like the best source of productivity is going to come through the examinations that you do.
Mm-hmm.
And unfortunately, all too many doctors look for a real quick fix.
Of course.
And what I call like low-hanging fruit. And they'll try to have overextended conversations with patients during a periodic check. And the problem is when you're trying to talk about extensive treatment during a periodic check, well, chances are you're not going to be able to answer all those questions in the time that you've got available.
Mm-hmm.
And it's likely that you've left another patient in the restorative room,
Sure.
in between a procedure to come over and do this.
Right.
So I think you can start to see what happens very, very quickly.
The machine starts to slow down.
Patients start to stack up, and patients have more questions.
Mm-hmm.
Or, on the flip side of it, you may have a lot of questions that you want to ask a patient, only to find out the patient doesn't have time to listen to you because they've got to pick up Joey at soccer and Susie at ballet and so on and so forth. So to get right to your question, I think the best thing for you to do is to save those conversations for a separate appointment. And
Beautiful.
so I think if you choose to reevaluate your patients selectively,
Right.
You can use your morning huddle to ask your hygienist, and even some of your assistants can
Mm-hmm.
get in on this, to identify patients who haven't been responding well to treatment.
Right.
You probably have a handful of patients that you can think of off the top
Mm-hmm.
of your head
Absolutely.
who have treatment needs that they haven't been addressing, or because of situations going on in their life, you've been holding them together.
Right.
It's kind of like that's what works
Patching
best for
them
them.
up.
Patching them up, and you've been holding them together, but now you can't do that anymore,
Right.
and you can't keep them at the same level. So if I'm making any sense, what you're hearing is that we're really looking for patients who need our attention again.
Patients that we already have in our
Patients, exactly. I don't think that this would be the time, depending on your funds,
Mm-hmm.
to have to spend a lot more money trying to acquire new patients when we have existing patients who need our expertise and haven't gotten it. So what I am saying is tomorrow morning, or right after you get done doing this clip, you can go back and look at the patients who are on the hygiene schedule and let them know that there's some things going on in your mouth that you're not happy with anymore.
Right.
Or, geez, we've been trying to hold you together all these years, and now it's come to the point where we've got to do something more permanent. So what you can offer to them is the opportunity to come back so that you could explain all these things to them.
Nice.
In the way that I would recommend that you do that is give them a benefit and make it something like they want to take advantage of.
Mm-hmm.
By saying to them, Miss Jones, you've got quite a few treatment needs that we really haven't been able to address before, and we need more time to talk about it than we've got available today. And you've been a long-standing patient in our practice. I think you would know. I don't mind taking the extra time and having you come back so I can review this with you. If the patient is now concerned about these treatment needs or curious about what you're going to say, they'll accept that reevaluation, and now you can do it at the appropriate time.
Nice.
Because you really want to change the environment.
And
you
when
want
you can
them
focus on them.
You want them to listen to you in a way that they haven't been listening to you in the past, and you're only going to get that if you change the environment.
Change the rhythm.
Of course, your hygienist is going to be thrilled because you're not trying to do this while they only have 10 minutes for you to do your exam. And they're thinking, what's going on here?
Right.
And then, of course, you might be moving patients to other treatment rooms.
Sure.
But the point is you've got all these people stacked up, and the person that you're trying to really can't focus on you.
Yes.
So let me give you a couple of tips here.
Okay.
I've mentioned already that it might be patients who have treatment needs that they haven't addressed as like the candidates. It might be people that you've been kind of holding up together,
Right.
And it's just now time that you should do something more permanent.
Right.
You might also go through your hygiene list of people who are coming in today on the schedule and notice who's due to have their FMX updated.
Nice.
Because that's a real good flag. You're due to get your records updated. Now,
it's probably been 5 years.
Right. I can sit down and reevaluate you because I've got the proper records.
Right.
But I would even go so far as to say, because you're a long-standing patient, I don't mind taking the extra time to talk with you about it, so that you could actually do this reevaluation at no charge.
Of course.
And so today you would charge them for a periodic examination. You could charge them for the FMX, and then when they come back, you've got all the data that you need to sit down with them. There's no need to charge them again.
Sure.
And so it could absolutely be complementary.
And it really is nice because you could have had your team kind of, you have an idea of what needs to be done. You can have your team kind of be prepared for that so that it's an even smoother transition.
Very, very smooth. The hygienist could make the offer first, and the patient may feel like, I don't think so. I don't really care about that. Now, for the hygienists who are listening, a lot of times you'll say something to a patient, and they may say no, and then the doctor comes in, and then they say yes. And I know you feel like, but I just brought that up with the patient. I don't know why they didn't give me the same answer. What you have to remember is that people have to hear things a couple of times. And so we do rely on you to sort of loosen the lid a little bit. So it's still good that you bring it up. They may turn you down, no problem. When the doctor comes in, you say, doctor, as we were getting ready for the meeting, you had mentioned to me that you wouldn't mind taking the extra time to meet with Mrs. Jones. However, she doesn't feel like it's a good time for her. So you do this right in front of the patient.
Sure.
She doesn't feel like this is a good time for her to, get into all of this. Well, guess what? You get to show your pleasure.
Right.
In a way that's easy for the patient to understand that you're concerned. Like you're not.
Right.
It's like there's just too much
Really?
going on. Yeah, it's just, okay. But you get my point. I think if the patient realizes that you're really disappointed that they're not doing this, they may decide that maybe they ought to.
Maybe enough of a nudge just to push them a little bit.
Even if they don't, I think if you respect how they feel about it, it's not surprising to me that they go home and drink something or eat something that doesn't go down well, and they start to think, that's what the doctor wanted to talk to me about, but I wouldn't listen.
Right.
And then they're back on the phone only to ask, please still give me that time.
Perfect. Perfect.
But I think in today's economic climate, the best source of examinations right now is let's take a look at your existing patient base. Those people already know you, they already like you, and they're going to appreciate the fact that you'd be willing to take this extra time to make things clear for them.
Yeah, I think it's a really simple solution. The system's already built. We don't have to create something or try and implement a new program. It just makes perfect sense.
You can start right now.
Fabulous.